Good afternoon. Today is Wednesday, May 13th. I'm Jim Weatherup, Chairman of the Oswego County Legislature. Joining me today are Diane Oldenburg, Senior Public Health Educator for the Oswego County Health Department, and Jake West, Senior Program Manager for Services to Aid Families. Over the past few days, there's been a lot of confusion about the testing requirements and Oswego County's testing capabilities. Let me assure you that the Central New York Regional Team, the county's COVID-19 response team, and our Community Health Partners team are doing everything we can to meet the requirements for reopening. I'm in daily meetings and discussions with other members of the Regional Control Room. We believe that we've met all the requirements outlined by the governor. However, we recognize that it will be a challenge for our local healthcare facilities to obtain enough test kits to sustain some of the testing requirements. We are working very aggressively to obtain more kits from the state in order to meet the governor's testing requirements for healthcare workers in skilled nursing and assisted living facilities. On behalf of the legislature, I want to thank the County Health Department, Oswego Health, urgent care facilities, and our skilled nursing facilities across the county for their dedication and commitment. We will continue to keep you informed of new developments and changes in procedures as this process evolves. I thank you again for your patience and cooperation. And now Diane Oldenburg will give today's report on COVID-19 cases in the county. Diane?
Thank you, Mr. Chairman. To date, we've had 2,302 residents tested or scheduled today to be tested for COVID-19. We've had 74 residents test positive for COVID-19. We have 62 residents that have recovered. We have 3 deaths in the county related to COVID-19. We have 9 active cases of COVID-19. We've received 2,142 negative test results back to the health department. We have 80 test results still pending. We have 69 residents currently under precautionary quarantine, and we have 62 residents that are in mandatory isolation or quarantine. And to date, 2,382 residents have completed or been released from monitoring. Thank you.
Thank you, Diane. Agencies across the United States have seen increases in violence and domestic altercations as a result of stress and anxiety caused by the COVID-19 pandemic. Today, we invited Jake West, Senior Program Manager at Services to Aid Families, to tell us about support services that are available to everyone in our county. Jake?
Thank you, Chairman Weatherup. I want to start by informing our community members and local service providers that Services to Aid Families is still operating as Oswego County's licensed domestic violence and rape crisis provider. We're here to support and provide service to victims and survivors during this difficult time. Survivors are facing additional barriers and concerns due to increased isolation and stress. With that being said, I do not plan to minimize the fact that if there is violence occurring in the home now, it is very, very likely that there was violence in the home prior to the COVID outbreak. We are extremely appreciative that the county legislature has invited us here today to discuss domestic violence and the resources available. Strongly urge our community and local government to continue support for victims and survivors after these difficult times have passed. During the first few weeks of social distancing and quarantine, our program saw a decrease in the number of calls to our 24-hour hotline. We attributed this to the fact that those who are experiencing domestic violence are essentially trapped in their homes with their abuser, making it much more difficult to reach out for help. Since the initial decrease in requests for service over the first couple of weeks, we have returned to a similar number of requests as we had prior to this outbreak. For reference, in 2019, we answered 3,454 hotline calls from survivors. Safe Staff continue to provide coverage to our 24-hour crisis hotline, operate our 18-bed emergency shelter, provide crisis intervention, emotional support, counseling, safety planning, information and referral, advocacy, long-term and emergency financial support, crime victim compensation assistance, legal assistance, and case management services to victims and survivors in our community. In addition, education staff are offering free virtual training to service providers and partnering agencies. For any additional information on what services are available, anyone can reach out to the hotline at 315-342-1600. The Oswego County Family Court is still hearing essential cases, including emergency orders of protection. Safe staff continue to assist victims in completing these petitions and are accompanying victims to virtual appearances in court. Although our service delivery model has changed and many services are being provided virtually, staff continue to meet the needs of survivors in our community. In closing, I would like to thank Oswego County legislators for allowing us the opportunity to share information on domestic violence services in our community and to let survivors know we're here for you, we support you, and we believe you. If you or someone you know is experiencing violence in the home, please reach out to our 24-hour hotline at 315-342-1600 to discuss options and services available. However, if it is an emergency, I urge you to call 911. Thank you.
Thank you, Jake, for the important work that you and your team at Oswego County Opportunities are doing to help people in crisis. Oswego County Opportunities has a wealth of services in place to help meet the needs of residents during these challenging times. Recovery and reopening will only work if everyone complies with social distancing and we are able to keep the number of new cases down. If we become complacent, the numbers will start to creep up again and the closures and restrictions will be extended. Please continue to follow these CDC and New York State Department of Health guidelines. Try to keep at least 6 feet of distance between you and others. Avoid close contact, such as shaking hands. Wash your hands often or use a hand sanitizer when soap and water are not available. Wear masks when appropriate social distancing cannot be maintained. Thank you for doing your part in helping to stop the spread of this virus. We are getting through this together.